Hello, welcome to Science Now. Today we're going to talk about ADHD. How does it affect someone's life? Are there different types of ADHD? What are the symptoms? And how about treatments? What about the newest prescriptions? I'll cover all that and more. I'm Michael Patterson, and this is Science Now, my new channel where we delve into the topics and the latest science, space, and mental health news. This episode is all about ADHD. ADHD is a catch-all term used to describe 7 different mental health subcategories. In general, ADHD is characterized by hyperactivity, lack of impulse control, and lack or misplaced focus. The affected areas of the brain are the prefrontal cortex and cerebellum, where rationalizing, advanced executive function, impulse control, concentration, attention span, judgment, organization, and planning are all located. The anterior cingulate, which helps the brain shift gears and detect errors, and the temporal lobes, which involve memory, learning, emotional reaction, mood stability, and visual processing. The basal ganglia that produces dopamine, and the limbic system. Phew, that's a lot, I know, but we needed to know which locations can be affected so that we can better understand the diagnoses. Not everybody checks every box in brain chemistry or brain abnormalities, but it is a solid basis. I'll touch on the different types of ADD and ADHD after I touch on ADHD in general. ADHD generally presents as a child, and it might not be caught until adulthood like me. ADD is an outdated term that was absorbed by the term ADHD. Diagnosis in children is more common in boys, though new research shows it affects boys and girls equally. But how it affects the two sexes can be vastly different. And according to the Center for Disease Control and Prevention, it's estimated that 6.4 million American children are diagnosed every year. And that's just children. Possible symptoms of childhood ADHD to watch for in your children are constant fidgeting or motion, interrupting others, difficulty playing quietly, trouble listening, easily distracted, can't finish a task before starting a new one, and talking a lot. ADHD affects around 13 million adult Americans. Any adult with ADHD was a child with ADHD that went undiagnosed into adulthood. Possible symptoms of ADHD in adults can include, but are not limited to, perpetual lateness, easily distracted, emotional outbursts, disorganization, intent focus on things they find interesting, inability to focus on things they find boring, trouble with personal relationships, trouble in the workplace, having a hard time starting challenging tasks, and issues with establishing priorities, along with forgetfulness, low tolerance to stress, work hard to gain other people's approval, overcommitting, hypersensitivity to stimuli, and trouble with time management. As you can see, there are plenty of symptoms, and why they further classified ADHD into 7 categories. Classic, inattentive, overfocused, temporal lobe, limbic, ring of fire or ADD+, and anxious ADD. In 2013, psychiatrist and nuclear brain imaging specialist Dr. Daniel G. Ullman released a book on healing ADD, the breakthrough program that allows you to see and heal from the 7 types of ADD, where he goes more in depth than we will on this video. However, I agree with Dr. Ullman that ADD is a better term than ADHD. Anyways, let's get into the 7 categories. Classic ADD are generally inattentive, easily distracted, disorganized, hyperactive, unable to sit still, and impulsive. People with classic ADD have a lack of blood flow to the prefrontal cortex and the cerebellum, and the basal ganglia. As we remember from earlier, the basal ganglia helps produce dopamine. That's why we treat classic ADD by increasing dopamine levels. Inattentive ADD do not suffer from hyperactivity but are easily distracted, sluggish, slow-moving, and lack motivation. Because this form of ADD doesn't cause behavioral problems as much as it tends to go undiagnosed. Inattentive ADD also have reduced blood flow to their prefrontal cortex, causing low dopamine levels. so treatment is the same, increased dopamine levels. Overfocused ADD is a type of ADD characterized by inflexible cognitive thinking, the inability to shift one's attention from task to task. Those with overfocused ADD display the same symptoms of classic ADD, but also have trouble shifting gears and tend to hyperfocus on tasks they find enjoyable. They also tend to get caught in cycles of negative thinking. They also display obsessive behavior, excessive worrying, inflexibility, frequently exhibit argumentative behavior. Those that suffer from overfocused ADD have frequent dysregulation of the anterior cingulate gyrus, which is involved in being able to shift your focus. The obsessive nature of this type of ADD causes some patients to be misdiagnosed as obsessive-compulsive disorder. Those with overfocused ADD lack both dopamine and serotonin, so treatment should be aimed at increasing both of those. Temporal lobe ADD. People affected by temporal lobe ADD have most of the symptoms of classic ADD, coupled with difficulty learning, trouble with memory, behavioral problems such as irritability, quick temper, aggression, dark thoughts, mood disruption, and mild paranoia. Those affected by temporal lobe ADD have reduced brain activity in the prefrontal cortex and obviously, as the name prescribes, abnormalities in the temporal lobe. Treatment is usually focused on combating the temporal lobe irregularities by regulating neural activity, usually with medication to slow nerve impulses. Limbic ADD. This combines classic ADD with disruptions in one's limbic system. Limbic ADD is caused by an increase in activity in the limbic system. People with limbic ADD also have decreased activity in the prefrontal cortex. Those that have limbic ADD suffer from low levels to moderate levels of sadness that is not depression, moodiness, low energy, frequent bouts of helplessness, hopelessness, or excessive guilt, worthlessness, and low self-esteem. Treatment usually focuses on the low serotonin and supplements and lifestyle changes. I'll cover more on treatment after we cover the rest of these ADDs. Ring of Fire ADD. This is a term given to individuals who have a ring of overactivity in the brain. The entire brain is overactive, across the cerebellum, the cerebral cortex, and other parts of the brain that can cause all the symptoms of classic ADD, in addition to symptoms like sensitivity to sound and light, touch, easily distracted, anger, irritability, periods of meanness or just nasty behavior, and unpredictable behavior, fast speech, anxiety, and fearfulness. Those individuals tend to be highly inflexible, very verbal, argumentative, and moody. Treatment usually consists of reducing brain activity in their hyperactive brain. Traditional stimulants for ADD may make symptoms worse. Anxious ADD. Individuals with anxious ADD exhibit classical ADD symptoms but also tend to be anxious, tense, have physical stress symptoms like headaches, muscle aches, and stomach aches. They tend to freeze up in situations that cause stress or anxiety. They also worry and anticipate the worst outcome in every situation, especially if they're being judged. Individuals with anxious ADD have high activity in the basal ganglia, opposite of most types of ADD, where they have low activity. Treatment for anxious ADD is by decreasing activity in the basal ganglia, promote regulation, and increase dopamine and GABA levels. ADD stimulants taken alone may make patients more anxious, so usually concurrent with an anti-anxiety treatment. Now that we know the 7 types of ADD, let's take a moment to talk about the different medications and specialized treatments, supplements, and more for each variation. Classic ADD is generally treated with stimulants. That stimulates part of the brain and helps balance it. One of the most well-known and most prescribed is Adderall. Adderall is a mix of 4 amphetamine salts and is used as a primary treatment. Choosing the right treatment can be time-consuming, trying to find which stimulant is best. For individuals, other stimulant medications are Ritalin, which is methylphenidate, Vyvanse, Concerta, Dexedrine, and numerous others. Mild classic ADD can be treated with supplements like green tea, ginseng, and the amino acid L-tyrosine, which is the building blocks for a couple of brain neurotransmitters, but most notably, dopamine. Over-focused ADD treatments are stimulants and antidepressants like selective serotonin reuptake inhibitors, or SSRIs for short. They work by reducing how much serotonin gets removed from the synapse, causing the brain to think there is more serotonin in the brain. Typical antidepressants are Effexor, Prozac, Prequist, Cymbalta, and Lexapro. Other useful supplements such as the amino acid L-tryptophan and 5-HTP, both precursors at different stages of serotonin production, in combination with L-tyrosine, also we mentioned previously is a precursor to dopamine. Others include saffron and inositol, a naturally occurring nutrient used to boost alertness, focus, mood, and mental clarity. Avoid a high-protein diet with this type of ADD as it may trigger mean behavior. Temporal lobe ADD treatment is similar yet different enough from classic ADD, and an increase in GABA in the brain, which can be an anti-anxiety medicine or a gabapentinoid like gabapentin or Lyrica, to help calm nerve activity and inhibit nerve cells from overfiring. Be careful, as traditional stimulants may be too overstimulating and may use a non-stimulant ADD medication like Strattera. Magnesium is also useful to help with anxiety and irritability. Anticonvulsants may also be used to help with mood stability. Ginseng and ginkgo can help with promoting learning and memory problems. Limbic ADD treatments consist of antidepressants like Wellbutrin and supplements like DL-phenylalanine, DLPA, L-tyrosine, and SAMI, which I'm not going to try to pronounce, and fish oil. Diet modifications and exercise are prescribed. Ring of Fire ADD treatments, stimulants alone may make symptoms worse due to overstimulation. Begin with an elimination diet and work on serotonin and GABA neurotransmitters through medications like gabapentinoids, benzodiazepines, and if the symptoms are mild, then you could supplement with GABA, L-tyrosine, and 5-HTP. Also, blood pressure medication like clonidine may also work to calm overactivity and hyperactivity. Anxious ADD can be treated with stimulants or non-stimulants. ADD medications sometimes paired with benzodiazepines like clonazepam, but begin with calming supplements like L-theanine and magnesium or holy basil. Sometimes tricyclic antidepressants are used to help lower anxiety. On top of the list of treatments like stimulants, non-stimulants, antidepressants, anti-anxiety drugs, antipsychotics, and off-label use of some drugs, there are treatments like therapy. Two of the most common types of therapy are cognitive behavioral therapy, or CBT, behavioral therapy, or BT, and CBT can help people with ADHD or ADD better understand how their disorder affects them, how it manifests in certain ADHD symptoms. CBT works by teaching the ADD patient how to recognize the way in which their thoughts can affect or manifest into their behavior. People in CBT are coached on how to change negative thought patterns on how they feel about themselves and their diagnosis. CBT doesn't directly treat the symptoms, just teaches them how their thoughts and behaviors are linked. It does help people to better manage their symptoms in the long run by providing mental and emotional support. For instance, CBT can help someone identify whether they're comparing themselves to others unfairly or setting unrealistic goals and set more realistic expectations based on their own abilities, needs, and desires. Stress management techniques are often taught in CBT because stress is a common trigger for ADHD symptoms. A CBT therapist may also help coaching them with co-occurrent disorders like mood disorders, anxiety, bipolar, depression, addiction, and more. Generally, people in CBT are better able to cope with their ADHD symptoms by improving executive function like time management, planning, and organizing. At the same time, they're able to develop better emotional and self-regulation and impulse control. Behavior therapy, unlike other types of talk therapy like CBT, PT is focused on practical ways to improve one's life. In this therapy, instead of teaching them about how their ADHD affects their thoughts that trickle into behavioral change, here ADD patients learn helpful skills that they can use in their daily life. Therapy will demand on what types of challenges a patient has. Some skills include how to organize or plan for the day, the future, and how to manage time better, focus, and how to improve impulsivity. Since BT is generally aimed more at children, their parents and possibly even their teachers can be involved. This can help ensure that the skills they learn are implemented in their daily life. For example, a child learns helpful strategies for paying attention in class or completing daily chores. This type of situation is often paired with a reward system to help to reinforce positive behavior. Group therapy, another type of therapy, can be another useful strategy for people with ADHD. On top of learning valuable life skills, they also get to engage with their peers, reinforcing the fact that they don't suffer alone. They may meet in person or online. Music therapy helps to create a creative environment as an outlet to help ADHD sufferers. And this treatment is helpful for children and adults. Even just listening to music can help them focus and relax. Social skills therapy is for people with ADHD who also struggle to be appropriate in social situations. Usually more geared towards children, it can help them form stronger social bonds and cause less frustration. Family and parenting therapy. Parents who have a child with ADHD can learn helpful skills and better understand their child's disorder. It focuses on ways to help support the child and encourages positive behavior, while helping families feel closer together, support and help better understand their loved one's behavior. One of the last treatments I found to be the coolest is called Endeavor RX. It is the first, and to my knowledge, only video game developed for ADHD that is approved as a prescription, generally for children ages 8 to 12. Endeavor RX is a digital therapy that improves attention function. It seems like a simple concept, limited to no side effects, and is 73% effective, as stated on their website. If you or a loved one shows any of the signs and is negatively impacting their life, schedule a visit with your family doctor and discuss your concerns. Ask for a referral to a psychiatrist or find a counseling facility that offers psychiatric help. That is how I found a psych doctor that took me seriously. It might take a few visits to make sure that you have ADHD instead of other mental disorders whose symptoms overlap with ADHD. They might include depression, bipolar, anxiety, or OCD. Please never give up. My life is totally different with the right diagnosis. Regardless of what your diagnosis is, knowing what you have and being able to treat it is the best outcome. Well, that's it for this episode of Science Now. I'm Michael Patterson. Thank you for watching to the end. Please leave a like, leave any questions in the comments below, share with someone who loves to learn about space, science, and mental health, and if you're subscribed and have the bell icon on, you're awesome, and I'll see you in the next one. Take care, and goodbye.